Hypertension. How to diagnose? A lot of people don't know that. The appropriate blood pressure ranges, some of the causes of high blood pressure, symptoms of hypertension or high blood pressure. We're going to look at the damage that having high blood pressure can cause to the human body. We're going to look at the risk of high blood pressure, and then we're going to discuss how to manage high blood pressure to include healthy eating. And that's when we're going to talk about understanding the effects of sodium and cholesterol on the body and how that impacts your blood pressure. We'll talk about lifestyle changes, exercise and activity, which are very important and necessary. We'll briefly discuss medications, and then for the end of this, we'll discuss our follow-up with our physician, because unfortunately, hypertension is not a disease that can be managed by itself. It takes the work of both the patient and the primary care provider to help to control the high blood pressure. So let's first talk about what is it? What is hypertension? It's better known as high blood pressure, and it's a situation or a condition that when your blood pressure increases, the force of your blood pushing against the walls of the vessels is consistently too high. And anytime you have a situation where there is pressure against a wall, that can lead to damage, even if we're not talking about the body. I mean, if you're pushing on a wall day after day after day, and that wall is not secure, the potential of that wall crumbling, falling, stretching are all there. And that can happen in the human body as well. So primarily, the way that high blood pressure causes harm is by increasing the workload of the heart and the blood vessels, making them have to work harder, less efficient, and the heart is a muscle. And what happens when we tend to work the muscles very heavily? They get bigger. And having an enlarged heart is not necessarily a good thing. So that extra work that it's taking to move blood through the body can cause a number of unfavorable consequences. Over time, this force and friction of this blood pressure damages those delicate tissues inside the arteries. In turn, bad cholesterol forms plaque. And I'll talk about what cholesterol is in just a little bit. But what happens with plaque is it tears the tiny vessel walls. It then sticks to the interior of those walls, and then it narrows the vessel itself. It's kind of like if we had a pipe and all of a sudden we're putting things in the pipe that are sticking to the inside of the pipe to the point that the pipe is occluded. Has anybody ever had a clogged drain? Leaves a mess, doesn't it? That's kind of like what's happening in the blood vessels with this plaque and this high cholesterol. And it causes a vicious circle that harms the arteries, the hearts, and the rest of the body. So, I need to change slides here. Okay, so how do I know if I have high blood pressure? You would be surprised at the number of individuals today that are walking around with the condition of hypertension or high blood pressure and don't even know it. And part of the reason for that is they excuse away the symptoms as being something else. Oh, I just have a headache because, the kids are getting on my nerves, or I'm just fatigued today and I've got this ringing in my ears and it's because there's been so much noise in my office today, or I just am not feeling well, but there's nothing really wrong. So ignoring high blood pressure can lead to very, very serious effects. So the best way to diagnose high blood pressure is to have the blood pressure measured. And you'd be surprised the number of places you can do that. Have you ever walked into a drugstore or even a grocery store, and they have the little monitor there where you stick your arm in and it checks your blood pressure? That is the best way to tell what's going on. And This is how measuring the blood pressure works. A blood pressure reading is taken with a cuff. It's an inflated circle that you put your arm in. During the test, the cuff is placed around the upper arm before being manually or electronically inflated. Then once it's inflated, the cuff squeezes the artery in the arm, monetarily stopping with the flow. Next, air in the cuff is slowly released while the person performing the procedure listens and monitors for the readout. Now, what that cuff is reading is the intensity of flow of blood through that artery. And with that intensity, you hear beeps or pulsing. And that is where that reading is coming from. So now that you've got a reading, what does that reading mean? You know, if someone says, oh, my blood pressure is 110/70, does that mean anything to you? Well, when we look at the numbers, the American Heart Association has defined targets for the blood pressure. A blood pressure category of normal is when the systolic, that's the top number, is less than 120, and the bottom number, which is the diastolic, is less than 80. Recently, there have been changes, and now the American Heart Association is saying to prevent heart attacks and strokes, it is ideal that the systolic, or the top number, be in the 110 rather than the 120. So you're looking at 115, 117 over diastolic of the 70s. And we're seeing that individuals, even with 120/80, periodically are having incidents of higher blood pressure. So those parameters are being lowered, especially in some of our ethnic populations, Hispanics and Blacks, because they commonly have high blood pressure. An elevated blood pressure is considered anything over that has a reading of 120 to 129 over less than 80. Now, when there's time to be concerned, it's when you have high blood pressure or hypertension stage 1. And those readings are generally between 130 and 139 as your systolic. And the diastolic is anywhere from 80 to about 89. High blood pressure or hypertension stage 2 is when the blood pressure, the systolic, is 140 or higher, or the diastolic is greater than 90. When we have a hypertensive crisis, that's basically defining the imminence of a stroke, a heart attack, or even a seizure. Those numbers are high. The systolic is higher than 180, and the diastolic is higher than 120. Basically, what those numbers are saying is you are in trouble, and you need to seek immediate medical attention. So knowing these numbers and knowing where you stand is vitally important in the management of high blood pressure. Does anybody think that the blood pressure changes? Or is it the same all day, every day? There are actually situations and circumstances that cause a rise in the blood pressure. And that rise can be significant. And we'll talk a little bit more about that in just a little bit. So, what are the signs and symptoms? Remember, I said people kind of ignore those things, go about their day excusing whatever their body is trying to tell them. These are the symptoms of having high blood pressure. It can be a severe headache, fatigue or confusion, vision problems. What I mean by vision problems, generally blurred vision. It can be pain in the chest, and it feels like a squeezing or a crushing pain. It can be difficulty breathing, irregular heartbeat, Does anybody know what an irregular heartbeat is like? Either too fast or too slow, or it's not making its normal rhythm. Those are all irregular heartbeats. Nosebleeds can be an indication. There are people who say, oh, I've had nosebleeds since I was a kid. But even as an adult, frequent nosebleeds are something that need to be addressed. Blood in the urine, that's a serious one. That can be an indication that your blood pressures are so high that you're causing irreparable damage to the kidneys. And pounding in your chest, neck, or ears. Any combination or any single symptom can be an indication that your blood pressure is either elevated or critically elevated, and you need to seek medical attention. So we talk about high blood pressure. What's the big deal? Well, the damage that is caused by high blood pressure can be severe. It can be, one of two things. One, a heart attack. High blood pressure can lead to cardiovascular events. And a heart attack can occur when that plaque in the blood clots and blocks the flow of blood to the heart muscle and the ventricle walls. Like I said, it's the clogged drain, if you will. And heart failure is the increased workload of the high blood pressure that can cause the heart to enlarge. Remember I said working that muscle too hard causes it to get bigger, and it fails to supply the adequate amount of blood to the rest of the body. So if you can imagine, part of the job of the heart is to circulate blood through every inch of our body. And if our organs aren't receiving adequate amounts of healthy oxygenated blood because of the failure of the heart to supply that blood, what's happening to the rest of our organs? I think it's called organ death. So these are why high blood pressure can be so severe. Blood pressure damages the tunica of the intestine. Then you guys don't really need to know all of that. Just know that the cholesterol in the body is made by the liver, and all the cholesterol our body needs, we make. And every other drop of cholesterol in the body is based on your consumption. And it's generally based on the consumption of animal fat. Now, there are some plants that have cholesterol, but you'll learn from me in a few minutes that cholesterol is a waxy substance. And if you can imagine a wax buildup on the engine of your car, what's going to happen to that car eventually? It's going to stop. The human body is the same way. So, what are some of the other effects of uncontrolled blood pressure? Well, cardiovascular events include not only heart attacks, but strokes. You can have vision loss or blindness. You can have heart failure, kidney disease, which I just mentioned, or even sexual dysfunction. Hypertension is a condition that doesn't allow adequate blood flow. And sexual dysfunction occurs when there is inadequate blood flow to the parts that need it. And so having high blood pressure can prevent an erection, can create a condition in women where they are having pain and excessive bleeding. And so sexual dysfunction is something a lot of people don't want to talk about. They get real uncomfortable. But just know, having high blood pressure affects the entire body. It's the silent killer. And you may not even know that there's anything wrong. Like I said, people, excuse the symptoms until it's too late. And then once, they're in an ambulance and on their way to the hospital and they find out they have high blood pressure, they're like, Well, I didn't know. And unfortunately, one of the reasons we have Hypertension Month is to bring an awareness to people. Because there are so many people in the United States today that are walking around with a condition that haven't got a clue that they have a problem. And they're a ticking time bomb. So, who's at risk? Why are they at risk? And so let's talk about the risk factors. We have two different kinds of risk factors for hypertension. One are the modifiable risk factors. That means you have the ability to change what's going on. And then we have the non-modifiable risk factors. Those are the risk factors you have no control over whatsoever. So let's look at our modifiable risk factors. The lack of physical activity, or what we call a sedentary lifestyle. I define a sedentary lifestyle as being the only exercise you're getting is lifting your fork from your plate to your mouth and back. Or you guys know the armchair quarterback. You've got the strongest thumb muscles in the world because all you're doing is sitting in your recliner hitting the remote. You're not doing anything else to exercise, not even getting up to go to the refrigerator to get your own beer. You're telling one of the kids or your wife, honey, bring me a beer. Sedentary lifestyles or the lack of physical activity puts you at risk for having high blood pressure. An unhealthy diet. We live in San Antonio, and I am the first to proclaim San Antonio has the best Mexican food in the world. I like San Antonio's Mexican food even better than I like Mexico's Mexican food. It's actually Tex-Mex, but having an unhealthy diet can lead to hypertension. And us as San Antonios at Fiesta, we like the fried onion ring, the corn dog, the Mexican corn, the sausage on the stick, the gumbo, the barbecue, the tamales, the chalupas, and all of these foods. And the majority of them have one thing in common, the F word, fried. And as Americans, we should eliminate fried foods from our diet because they are a leading contributor to hypertension and some other diseases as well. Being overweight by virtue of the fact that you are larger than your targeted body mass index puts you at risk for having high blood pressure. Drinking too much alcohol, having sleep apnea, having high cholesterol, diabetes, smoking or tobacco use, and high stress environments all can lead to having high blood pressure. So these are things that you have the ability to change or control. But there are things that put you at risk for developing high blood pressure that you have no control over at all. High blood pressure is hereditary. And so your family history plays a role in the fact that you are at risk for developing high blood pressure. Your age, as we get older, the body changes. There are less hormones produced. We tend to exercise less. We tend to eat less, but as a nation, we tend to eat more fast food, processed food, and vending machine foods. And all three of those things have three things in common: salts, fats, and sugar. And those salts, fats, and sugars are the major contributor to a number of unhealthy conditions, hypertension being one of them. Okay. Your gender, did you know that? That men tend to have more high blood pressure long term. Women tend to have high blood pressure depending upon their environment, their work environment, their home environment. You know how you say the kids get on your nerves? Well, guess what? That stress environment can cause you to have high blood pressure. Working in conditions that are not favorable, physically, emotionally, psychologically, put you at risk for having high blood pressure. And your race, you already kind of touched on that. For some reason, genetically speaking, the gene for high blood pressure seems to be more common in Blacks and Hispanics in this country. So, how do we manage high blood pressure? Well, eating a well-balanced meal that's low in salt or sodium and low in cholesterol tend to help. It lowers your risk for developing the disease. Limiting your alcohol consumption. And we'll talk about what those limits are in just a few moments. Having regular physical activity. Managing your stress. One of the questions that was sent to us regarding stress management was about managing stress during pregnancy. One of the things that helps to manage stress during pregnancy to help to keep the blood pressure low is actually exercise. Exercise during pregnancy is very healthy and very important. It is the type of exercises that are of concern, and you should communicate with your physician about what healthy exercises are for you in different stages of your pregnancy. For the most part, yoga is very good. Tai Chi is another. Walking. Other exercises are okay depending upon the individual. So it's important that you have that conversation with your physician. Maintaining a healthy weight. Remember, being obese puts you at risk. And so maintaining a healthy weight lowers your risk for developing high blood pressure. Smoking. I cannot tell you enough the impact that smoking and tobacco use have on the body. One of the things we left off of there is vaping. It's just as bad, and it puts you at risk for developing hypertension or high blood pressure. Taking your medications properly. There are a lot of patients, for a lot of reasons, that periodically stop their meds. Stopping your meds increases your risk for developing hypertension. And you need to work together with your doctor because they're going to be able to help you address the issues that impact you specifically and how that works with the decrease in not only hypertension, but high cholesterol and diabetes. Did you know that in the United States today, the #1 cause of cardiovascular events, meaning strokes and heart attacks, are the combination of 3 things: having high blood sugar, which is diabetes, high blood pressure, which is hypertension, and high blood cholesterol or high blood fat, which is known as hyperlipidemia. The combination of those 3, unmanaged, is a heart attack or a stroke waiting to happen. So one of the things that is recommended for individuals with high blood pressure is the DASH diet. So let me clarify something real quick. Everybody thinks, oh, they're just trying to get me to use that salt substitute, Mrs. Dash. Believe it or not, the two have no relationship. The term DASH actually is an acronym for dietary approaches to stop hypertension. And sodium plays a big role in hypertension. Sodium, or sodium chloride, as you would call table salt, causes us to retain fluids. That retention of fluid increases the work of the heart, which in turn leads to hypertension. So following the DASH diet and reducing the amount of sodium helps to lower the blood pressure. The combination of an eating plan that reduces your sodium and getting the better benefits from eating healthy help to develop a lower blood pressure, but that intake of high sodium helps to develop high blood pressure. Have you ever known a person that before they ever pick up their fork to taste their food, the first thing they grab is the salt shake? And they're salting their entire plate, increasing the amount of fluid that the body retains, increasing their blood pressure. So the DASH diet is designed to help an individual either one, prevent high blood pressure, or two, manage high blood pressure. And I've left you the link to a guide to lowering your blood pressure, which is this book, The DASH Diet. And you'll find that in the book, it not only gives you recommendations as to your limits, it suggests certain foods to eat and avoid. And I'll discuss some of those in just a few minutes as well. So, a heart-healthy diet, that's important for all of us, but that's important especially for individuals who have high blood pressure. One, you want to control your portions. A portion and a serving are not necessarily the same. For example, a serving of cereal would be 1 cup. A portion is what you put in the bowl. And most people eat more than a cup of cereal for breakfast. A serving of ice cream is 2/3 of a cup. That's the little things we give the kids at the birthday party. You know, the little Bluebell or HEB cup, that's a serving. Did you know a scoop of ice cream is 2 servings? So if you ate a bowl of ice cream with 6 scoops, you ate 12 servings. Ouch. Can you imagine the fat in 12 servings of ice cream? So we want to select foods that have more whole grains. We want fresh fruits and vegetables. In the hierarchy of selecting fruits and vegetables, fresh is always best. Then frozen, and canned is the last resort. And when you're purchasing canned vegetables, you always want to look for things that say no salt added, low sodium, because that's the salt that's causing the increase. And did you know that 99% of processed foods contain salts, fats, and sugars? We want to choose low-fat protein sources. Let me give you an example. A source of meat that has the description loin tied to it is going to be healthier than a cut of meat that doesn't. For example, pork tenderloin is going to be healthier for you than a pork chop. Beef tenderloin is going to be healthier for you than pot roast. A sirloin steak is healthier for you than a ribeye. Now, I know some people are rolling their eyes and they're like, I'm not giving up my ribeye or my T-bone. But if you take a look at that cut of meat, either one of those, you'll see that they're in the ribeye, the fat is marbled all through the meat, which gives it its flavor and its tenderness. But what are you consuming? You're consuming that fat. And a T-bone steak usually has that ridge of fat around the outside and that bone in the middle. You're still consuming excessive amounts of fat. Let me give you my saying in regards to our protein sources. And I'll have you think about that for just a second. The less the feet, the better the meat. And people are going, what? Okay. How many feet does a pig or a cow have? 4. What about a chicken or a turkey? Those are 2 feet. What about a fish? No feet. An egg? No feet. What about tofu, edamame, mushrooms? No feet. Again, the less the feet, the better the meat. Think about that. Okay. You want to plan ahead. Create a dietary menu daily. Meaning don't emergency eat. I'm about to say something I know that's going to get eye rolls in a second. You know, we do these lunch and learns, or we do diabetes education classes or hypertension classes, and they're usually scheduled right before or during lunch. And so by the time you're finished sitting listening to someone like myself talk, it's lunchtime and you're hungry. No, it's lunchtime and you're hangry. You're ready to eat. So your first response is to leave here, go through the drive-through at Whataburger, and you say, I want the Whataburger with cheese, no onions, a large order of fries, and throw in a Diet Coke. Oh, and while you're at it, put one of those cinnamon rolls in the bag. We just have made an order to emergency eat, rather than thinking about what we put into our body and asking the question, is this my medicine or is this my poison? And if we don't think about it and we just react, 90% of the time, we're going to make the wrong choice and we're going to order the poison. Allow yourself an occasional treat. That helps to prevent you from overindulging. So these are the tips for a heart healthy diet. So what effects do fats and cholesterol have on our blood? Does that plate look familiar to anybody? Yeah. Me too at one time, but not anymore. So let's talk about what fats and cholesterol are. So the definition of fats and cholesterol. Fats are a greasy substance found in the tissue of animals and some plants. Many of the foods we eat contain fats. Fats from animals such as milk, meats, eggs, all contain fat. So, do some plant-based foods also have fats, such as nuts, avocados, and olives? But those are good fats. Fat is organized into 2 different subcategories: saturated fats and unsaturated fats. Hydrogenated fats, non-hydrogenated fats. And you can tell the difference with your eyes, believe it or not. A saturated fat or a hydrogenated fat turns solid at room temperature. And those are the bad ones. Think about that for just a minute. Crisco, lard, bacon grease, coconut oil, stick butter, and margarine are all solid at room temperature. So think about this for a second. If it's solid at room temperature, sitting in a skillet that's been left on the stove, what is it in your body? Cholesterol is a waxy substance, and it's not inherently bad. But like I told you before, your body needs it to build cells and to make vitamins and other hormones. But too much cholesterol poses a problem. That cholesterol comes from 2 sources. One, your liver, And your liver makes all the cholesterol your body actually needs. And the rest of the cholesterol in your body comes from the foods that you eat. And that's usually animal fat. For example, meat, poultry, dairy products, all contain dietary cholesterol. Did you know that seafood, shellfish, are high in cholesterol? That's your shrimp, your crab, your lobsters, your oysters, your crawfish, your mussels, and your clams. They are all high in cholesterol. And the recommendation is that they should be consumed about once every 2 weeks, rather than daily or 2 to 3 times a week. And I say that because my ex-husband could have been bubblegum. He would eat shrimp every day if you let him. Then his cholesterol went up, his blood pressure went up, and we had to take him off of seafood as frequently as he was having it. Okay, next slide. So, how do we know how much fat or cholesterol we should be consuming? Well, the Federal Drug Administration and the food recommendations by the College of Endocrinology and the American Heart Association say that as far as fat is concerned, we should consume no more than 5 grams of total fat per serving, or less than 5% of the total calories. And your daily values are the percentage of your total calories. So if we're looking at our total fat for this particular item, which happens to be Kraft macaroni and cheese, I'm letting you know what you're looking at. Total fat for Kraft macaroni and cheese is 12 grams per serving. Oh, and by the way, a serving is a cup. Now, how many people do you know eat a cup of Kraft macaroni and cheese? Even if it's a side dish. You got 2 cups of macaroni on your plate to start. And don't let me go to Luby's, because they serve you what? 2.5 cups of that macaroni and cheese? So 1 cup contains 12 grams or 18% of the fat that is recommended for you per meal. So my response to that is, no, too much fat. Now let's look at cholesterol. It is recommended that our cholesterol consumption is no more than 200 to 300 milligrams per day. So if you break that down per meal, it's somewhere around 75 milligrams per meal. So if we look at the total cholesterol for this particular item, our total cholesterol is 30 milligrams. So the cholesterol isn't that bad, but the fat is. So when evaluating a food, we want to look at the recommendations for that particular item or macronutrient and the serving amount and the recommendation. So if it is recommended that we have no more than 5 grams of total fat per serving, would macaroni and cheese be your medicine, or would that be your poison? The answer to that question is poison. That's your poison. And so learning what the recommendations are, learning to evaluate foods as either your medicine or your poison based on those recommendations helps you determine whether or not a particular food is your medicine or your poison as it relates to your blood pressure. Does that make sense? Yeah. People in the room are nodding their heads, so I know that they think that makes sense. Okay, next slide, please. So, how do we choose healthy fats? What are healthy fats and what are unhealthy fats? Well, first off, we want monounsaturated fat. Mono meaning one, unsaturated being healthy. And so examples of those are olive oil, canola oil, avocados, nuts, things of that nature, grapeseed oil. People say, well, how do you know if it's a healthy oil or not? And I very sarcastically say, is compare the price. I know that sounds sarcastic, but seriously, the more it costs, the healthier the oil is for you. A can of grapeseed oil, the same size as a Diet Coke, is over $10. Ouch. But yeah, that's one of the healthier oils. Sesame seed oil, that's expensive. Vegetable oil is not near as expensive, which tells you it's not as healthy for you as the avocado oil, the canola oil, or the avocado oil. And I hear people say, oh gosh, yes, I know. Avocados are very good for me. I eat an avocado 2 meals a day. A serving of avocado is 1/4 of an avocado. Yeah, that may be news to you as well. So that whole avocado that you're having, or that entire bowl of guacamole, is not necessarily your medicine. We have to control our portions as well. Now, the polyunsaturated fats are those like our omega-3 fatty acids, which come from fatty fish, flaxseed oil, canola, soybean oil, and walnut. Our omega-6 are our vegetable oils, corn oil, safflower, cottonseed, sesame, and sunflower oil, and soft margarine. We know that soft margarines or spreadable butter are healthier for us because there is a lower percentage of animal fat, and you have the addition of some of the healthier omega-3s or monounsaturated fats added, like butter with olive oil, butter with canola oil, or butter with safflower or avocado oil. And those are all three found very commonly in the grocery store if you look for it. And you know it's healthier because it spreads. The more fat, the thicker it is, and the more solid it can become. So we want spreadable or sprayable butter. The unhealthy saturated fats, we already said, they're solid at room temperature. Open a can of Crisco. What have you got? Or look at a block of lard or manteca. Those are solid. Or look at the fat that is left over after cooking things like bacon or fatty meats. There's that film of solid fat. That's not digestible. It sticks to the arteries in our body, clogging them, creating pressure on the heart, which leads to high blood pressure. So those unhealthy fats are the trans fats that are chemically altered, and they cause a rise in our bad or our lousy cholesterol. And the cholesterol in the body works like a seesaw. The higher the bad cholesterol, the lower the good cholesterol. The lower the bad cholesterol, the higher the good cholesterol. And so we want to try and keep the good cholesterol always higher than the bad cholesterol. The things that we should avoid are candies, shortenings, stick margarine, packaged crackers, packaged cookies, I know the Girl Scouts of America are about ready to throw something at me, but yes, packaged cookies and packaged baked goods. Those are all high in saturated fats and very unhealthy for us. We want to cut the fat. We want low-fat cooking. Trim the visible fat off of the animals and the skin off of meats. Have white meat versus dark meat. Did you guys know that? That the white meat of poultry is healthier for us than the dark meat? Personally speaking, until I learned this, I was definitely a thigh and a leg kind of girl. Now I'm a breast or a wing kind of girl because white meat has less fat. We want to saute foods in water instead of animal fat. You know how our grandmothers would cook vegetables or beans, and the first thing they throw in there is that hunk of fat or that bacon grease to flavor it? That's not necessarily our medicine. It's more like our poison. Okay. Use vegetable oils and sprays instead of lard or butter. Use non-stick sprays and pans that don't stick. Okay. Non-stick cookware. Roasting, steaming, broiling, and baking don't require you to add additional fat. So those are healthier ways to prepare foods. And we want to eliminate the F word. The F word is fry. Now, I will say this, I am a proponent of an air fryer because you can get the same effects from an air fryer that you can from deep frying food, like chicken and shrimp and potatoes. Using an air fryer cuts the amount of fat that you're getting in the body. We want to improve our cholesterol by increasing our good cholesterol and decreasing our bad cholesterol. The HDL cholesterol can be thought of as our good cholesterol or our happy cholesterol. So I always tell patients the H stands for happy. So we want to increase our happy cholesterol, and the L stands for lousy. And so we want to decrease our lousy cholesterol or our LDL. And the way that this works is the HDL helps to carry the LDL cholesterol away from the arteries and kick it back to the liver, where the LDL is broken down and passed from the body. So the more good cholesterol we take in, the less bad cholesterol we have. And that good cholesterol helps to move that bad cholesterol back to the liver, where it is discharged from the body. Next slide, please. So foods that are high in cholesterol that we need to avoid are full dairy products, full fat dairy products. There is no reason for an adult to be drinking whole milk. If we're drinking milk, we need to be drinking 1 to 2%, or what we call milk substitutes. Almond milk, soy milk, some oat milk. Please be careful with rice milk because rice milk does contain some sugars. Right? We want to limit or cut out our red meats like steak, beef roast, ribs. I know everybody in the room is like, what? Pork chops. And we want to make sure that if we're consuming ground beef, it is 90% lean. That 70-30 means that 70% of it is lean, and the other 30% of what you're eating is pure animal fat. So 70-30 ground beef is our poison, okay? We want to eat foods that are lower, not higher, in saturated fats and cholesterol content. We want to avoid processed meats. One of the number one processed meats is bologna. I don't mean it's bologna, it's actually bologna. Our processed meats, our cured meats, such as hot dogs. And plus, if you've ever seen how a hot dog is processed, you won't need another one anyway. So we want to avoid the fried foods. We want to avoid baked goods and packaged sweets because those all are high in cholesterol. Some of the best high cholesterol foods you can eat, though, are things like eggs. The recommendation is for every 2 eggs, you only eat 1 yolk. The majority of the cholesterol in an egg is in the yolk. Okay, about 60% of the daily value of cholesterol you find in 1 egg. But it is only containing 8% of your allowance for the saturated fats. So eggs are high in protein, low in calorie, 0 carb, and they contain vitamins B, iron, and disease-fighting nutrients. So again, I'm not saying completely eliminate eggs from your diet, but for every 2 eggs, only 1 yolk. Shellfish, we just talked about that. Shrimp is notoriously high in cholesterol, packing in more than half of your daily value in a 3-ounce serving. A 3-ounce serving of shrimp is 2 shrimp. So 2 shrimp are very high in cholesterol. But its saturated fat content is practically non-existent. So having shrimp isn't necessarily as bad for you as having fried shrimp. So if you're going to have shrimp, you need to have it broiled or grilled. I don't think I've ever had baked shrimp. Okay? That doesn't sound too appetizing. Broiled or grilled shrimp are good. About once every 2 weeks. So we want to limit our shellfish consumption because it has good sources of protein and vitamin B, psyllium, and zinc. But again, it cannot be a food that you have every day. We want lean meats, cuts that are lean meats and high in cholesterol, but low in saturated fat. They include liver, like liver pate. I don't like it personally, but if you do, more power to you. You want to be careful and include things like kidney beans, sweetbreads. Does anybody know what sweetbreads is? I found out sweetbread is the pancreas of a cow. I'm not sure I'm going to eat it, but it's high in cholesterol, but low in fat. The heart and gizzards and liver of animals, to include tripe, are all high in cholesterol, but low in fat. While they might not find these meats to be appealing, they are better options than the processed or red meats. Isn't that interesting? So basically they're saying eat pancreas rather than hot dogs, or eat liver more than you eat Spam, potted meat, or bologna. It's all about moderation. Remember, a serving and a portion are not necessarily the same. Alcohol. You know, we just came out of Fiesta, and there was a lot of alcohol consumed. And knowing that if you drink too much, you can cause a rise in your blood pressure to a very unhealthy level. Having more than 3 drinks in one sitting temporarily increases your blood pressure, but repeated binge drinking, fiesta, can load or lead to long-term increases. So binge drinking is very unhealthy for you. And what alcohol does is affect or interfere with the metabolism in the liver, can cause issues with the heart, and too much alcohol causes a compete or consumption that reduces the magnesium levels in the blood, which lead to a rise in blood pressure. So alcohol, where it may taste good, can cause serious issues when it comes to the blood pressure, the blood sugar, and can lead to heart attack and stroke. So the role that physical activities play in controlling the blood pressure and controlling the cholesterol are this: a regular physical activity is one of the best treatments recommended to control blood pressure, diabetes, and hypertension. By exercising regularly, it helps to protect the body against high blood pressure and cardiovascular disease. So exercise is an essential part of our daily life, our lifestyle and lifestyle changes. So studies show that by reducing this systolic blood pressure by 5 millimeters megahertz, death from strokes can be reduced by 14%, and death from heart disease can be decreased by 9%. What that means is we can reduce our risk for heart attacks and strokes by 14% or up to 14% if we just exercise. Regular exercise is key to preventing and increasing heart attacks and strokes and preventing and treating hypertension. There are people that have been prone or have high blood pressure their whole lives that can actually reduce their risk for heart attacks and strokes by merely exercising. And it doesn't matter what kind of exercise. And what my grandkids always say is, you got a Madagascar. And I'm like, you've got to move it, move it. You've got to move it, move it. So movement and activity are an essential part of controlling the blood pressure and hypertension. So weight and high blood pressure affect the body. And so we want to show you just very quickly, being overweight or obese increases your risk for the development of high blood pressure. If you look at the percentage of individuals that have high blood pressure, you're going to see that the majority of individuals that have obesity, 43% of those, almost 44% of them, have high blood pressure. Being overweight, 32.4% of them have high blood pressure, which is a contrast to the individuals who have a healthy weight, which is 20% of them having high blood pressure. So losing even 10 pounds can lower your blood pressure, and losing weight has the biggest effect on those who are overweight and already have hypertension. Smoking and high blood pressure. The nicotine in cigarette smoke is the problem. It raises your blood pressure and your heart rate, narrows your blood vessels, and hardens the walls of your arteries, making the blood more susceptible to clotting. Smoking stresses your heart and sets you up for a heart attack or a stroke. Some of the statistics from the American Heart and Lung Association say if you smoke, stopping is the best thing you can do for yourself. 20 minutes after you've smoked, the blood pressure starts to lower. But 8 hours after you've smoked, your risk for heart attacks and strokes start to fall when you've quit. 15 years after quitting smoking, your risk tends to be almost nothing. So stopping smoking at any level, at any time, can improve your blood pressure and decrease your risk for the development of high blood pressure, heart attacks, and strokes. Blood pressure medications. A lot of people have difficulty with blood pressure medications because it causes some side effects or can. As part of a solution designed to fit your needs, your doctor and you determine what your prescription for blood pressure medications are going to be, in addition to the lifestyle changes that you're going to need to make in order to control your blood pressure. Long-term healthy consequences of uncontrolled blood pressure are often worse than any medication side effects that you receive. If you have a concern about taking blood pressure medications, you should talk to your doctor or your pharmacist. Many blood pressure medications are known as antihypertensives and are available by prescription that help to lower the blood pressure. There are a variety of classes of blood pressure medications, and they include a number of different drugs. Okay? You, along with your physician, determine the medications that are going to be best for you. Okay? That needs to be a discussion that you have with your doctor. And if one medication isn't necessarily working or optimal for you in controlling your blood pressure, just know that there are other medications or combinations of other medications that can help. But again, that takes you and your doctor working together. So remember to follow your healthcare provider's instructions. Eat well, get plenty of rest, avoid salty foods, exercise regularly, follow up with your provider regularly, monitor your blood pressure as instructed or directed, reduce your stress, stop smoking, and take your medications as prescribed. So, blood pressure control is a lifetime condition. Managing the blood pressure is a long-term commitment. Do your part, start today for yourself and for those you love. Partner with your doctor to treat your high blood pressure. You can't do this by yourself. Take your medications as provided and act on the information to live a heart-healthy life. That concludes my discussion. Does anyone have questions? Anyone in the room have questions? If you're online with this, please put your questions in the chat, and Heather's going to help me to help answer those questions for you. You guys have any questions? No?